Hello everyone, now let us discuss about anatomy of musculoskeletal system. In the current session, we will be focusing on hyoid bone and vertebral column. Now coming to hyoid bone, the single hyoid bone, which is nothing but U-shaped. Here you can see the shape of the hyoid bone is U-shaped, is a unique component of the axial skeleton as it does not articulate with any other bone. So what is the bone in the body that does not articulate with any other bone is hyoid bone. It is suspended from the styloid process of the temporal bones by ligaments and muscles. And the major function of hyoid bone is that it supports tongue, provides attachment to some of the tongue muscles and the muscles of neck and pharynx. Coming to the clinical significance. In what way is hyoid bone clinically significant? The hyoid bone and the cartilages of the larynx and trachea are often fractured during strangulation. And as a result, they are carefully examined at the autopsy when manual strangulation is suspected cause of death. The hyoid bone and the cartilages of the larynx and trachea are often fractured during strangulation, and as a result, they are carefully examined at the autopsy when manual strangulation is suspected cause of death. Now coming to vertebral column. The vertebral column, also called as spine, backbone or spinal column, makes up to 2/5 of your total height and is composed of series of bones called as vertebrae. The major function of vertebral column is it encloses and protects the spinal cord, supports the head and serves as a point of attachment to ribs, pelvic girdle, muscles of back and upper limbs. Coming to the number. The total number of vertebrae during the early development is 33, and as the child grows, several vertebrae in the sacral and the coccygeal regions, they fuse. As a result, adult vertebral column typically contains 26 vertebrae. So an adult vertebral column contains 26 vertebrae. And the vertebrae are divided based on the region. Coming to the various vertebrae, they are cervical vertebrae, thoracic vertebrae, lumbar vertebrae, sacrum and coccyx. There are 7 cervical vertebrae in total, 12 thoracic vertebrae, 5 lumbar vertebrae, 1 sacrum and 1 coccyx. One sacrum is formed by 5 fused sacral vertebrae, whereas one coccyx is formed by 4 fused coccygeal vertebrae. So in total 7 plus 12 plus 5 plus 2, 1 sacrum and 1 coccyx. 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 1 sacrum and 1 coccyx. So here you can see the diagram. 1 to 7. 7 cervical vertebrae, 1 to 12. 12 thoracic vertebrae and 1, 2, 3, 4, 5. 5 lumbar vertebrae. In between the grey colored thing is intervertebral disc, sacrum and coccyx. Coming to the curves of the vertebral column. Usually there are normal curves in the vertebral column. The purpose of curves is they increase the strength, help maintain the balance in the upright position and absorb the shocks during walking and help protect the vertebrae from fracture. These are the functions of natural curves. They are of 2 types, primary curves and secondary curves. Primary curves are the curves of thoracic and sacral curves because they retain the original curvature of the embryonic vertebrae. For that reason, they are called as primary curves. The thoracic and sacral curves, they retain the original curvature of the embryonic vertebrae. As a result, they are called as primary curves. Now coming to secondary curves, they began to form later several months after the birth. Example of secondary curves are cervical and lumbar curves. Cervical and lumbar curves are not present at birth, but they develop over the process of several months. For that reason, they are called as secondary curves. Now coming to intervertebral disc. They are found between the bodies of adjacent vertebrae from the second cervical vertebrae to the sacrum. So intervertebral disc mainly has two parts, outer fibrous ring, which is called as annulus fibrosus, and an inner soft pulpy highly elastic substance which is called as nucleus pulposus. Outer fibrous ring is called as annulus fibrosus. Annulus means ring-like, whereas inner soft pulpy highly elastic substance is called as nucleus pulposus. And one more important point about intervertebral discs are they are avascular and they rely on blood vessels from the bodies of vertebrae to obtain oxygen and nutrients and to remove waste. Intervertebral discs are avascular and they depend on the blood vessels of bodies of vertebrae to obtain oxygen and nutrients from the waste. Two parts are outer fibrous ring and inner soft pulpy highly elastic substance called as nucleus pulposus. Coming to the basic parts of the vertebrae, whether it is cervical, thoracic or lumbar, though they are different from each other in a significant way, they have some common elements such as specific parts. Each vertebrae has vertebral body, vertebral arch and several processes. The vertebral body is the thick disc-shaped anterior portion is the weight-bearing part of the vertebrae. Vertebral body is the weight-bearing part of the vertebrae and it is thick disc-shaped anterior portion. Coming to vertebral arch, the two short thick processes which are nothing but the pedicels, they project posteriorly from the vertebral body and they unite with flat laminae to form the vertebral arch. The pedicels, they project posteriorly from the vertebral body and they unite with flat laminae to form the vertebral arch. Coming to processes, mainly there are three types of processes: transverse processes, spinous processes and articular processes. The transverse process, there are two transverse processes at point where lamina and pedicel join. A transverse process extends laterally on each side. A point where lamina and pedicel join, a transverse process extends laterally on each side. The next is spinous process. It is one, projects posteriorly from the junction of the lamina. Whereas articular processes, there are four, two superior and two inferior. Articular processes are they contain articular surfaces called as facets. Articular surfaces of articular process are called as facets. Now let us compare all three vertebrae, cervical, thoracic and lumbar. If you observe, they all have the common points such as spinous process, transverse process, arch, vertebral arch and vertebral body. This also has spinous process, transverse process, this is the arch and this is the vertebral body. Here also this is the vertebral body, this is the spinous process, these are the transverse process. Articular facets and articular processes are also present. Now coming to the size, cervical vertebrae are the smallest vertebrae whereas lumbar vertebrae are the largest. Based upon size, the ascending order is cervical, thoracic and lumbar. Cervical is smaller, thoracic is larger, whereas lumbar is largest. Coming to foramina, cervical vertebrae has one vertebral and two transverse foramina, whereas thoracic vertebrae has one vertebral foramina and lumbar vertebrae will also have one vertebral foramina. Coming to spinous process, the spinous process of cervical vertebrae is slender, often bifid. Slender, often bifid. Here you can see two. That indicates it is bifid. Coming to the spinous process of thoracic vertebrae, it is long and fairly thick. Coming to the spinous process of lumbar vertebrae, it is short and blunt. Coming to the transverse processes, cervical vertebrae, the transverse processes are small, whereas thoracic vertebrae has fairly large transverse processes. Lumbar vertebrae has large and blunt transverse processes. Coming to articular facets of ribs. So which vertebrae contains articular facets for ribs? Facets are the points for attachment of ribs. So thoracic vertebrae contains articular facets of ribs, whereas articular facets for ribs are absent in cervical and lumbar vertebrae. Because thoracic vertebrae, they are joined with ribs with the help of articular facets. Coming to the size of intervertebral discs. The intervertebral disc of cervical vertebrae, it is thick relative to the size of vertebral body. Whereas the intervertebral disc is thin relative to the size of vertebral body. Whereas the lumbar vertebrae has the thickest intervertebral disc. Lumbar vertebrae are largest in size and they have thickest intervertebral discs. These are the brief comparison points between all three vertebrae, cervical, thoracic and lumbar. Thank you for watching. Please subscribe for further videos on anatomy and physiology.